Hello and welcome. You're watching The Big Story with me, Sanika. We'll be joined by an esteemed panel of doctors where we will take the frequently asked questions, the questions that our viewers have on our minds now that the vaccine drive is set to begin for all adults. What are the general practices that are supposed to be adopted? We will have a panel of doctors joining us to take the most asked questions. We have Dr. Sanket Jain, who is a consultant chest physician, pulmonologist from Masina Hospital in Mumbai. Dr. Jaydhar Gupta, founder of Nirvana Being and founder of Citizen Movement, My Right to Breathe. He's joining us live from Mumbai. And Dr. Zahir Virani, nephrologist and a member of Maharashtra COVID Task Force as well. And as we are set to begin our first, the biggest vaccination drive, my first question, I would like to direct my first question to Dr. Zahir Virani, who is a member of the Maharashtra Task Force as well. Dr. Virani, is only a single dose of vaccine enough for immunity against COVID-19? Now I'm asking this question, and probably this is a question that a lot of viewers are asking because there are lots of reports that are coming in. There was a UK study which said that even a single dose of AstraZeneca vaccine or a Pfizer vaccine would be enough for immunity. And even there are some reports from United States of America as well, where 8% of citizens are skipping their second dose. So that is why probably this is a question that is being asked on whether a single dose of vaccine would be enough for immunity against COVID-19.
Good evening. First of all, I would like...
You have to take both the doses of the vaccine, whether it is the Pfizer or the Moderna or the COVID-19, which is the AstraZeneca vaccine or a Covaxin. The single dose which was there was actually, there is a study which is showing that people who have been infected with COVID, like SARS-CoV-2, and if they take a vaccine, a single dose, then that might act as a booster dose. But at present, it is advisable for everybody to take both the doses of the vaccine. As you know that the Covishield, they have extended the dose of the second dose to 6 to 8 weeks, and even some people are giving it at 12 weeks. But as far as the other vaccines are concerned, they have different time periods. We don't have Pfizer and Moderna with us right now, so it will be not prudent to speak about them at present. But the general population, everybody should understand both doses of the vaccine are required.
Yes. Thank you, Dr. Virani, for clearing that out. My next question would be to our next guest, Dr. Sanket Jain, who's joining us live from Mumbai. I would like to take two questions from our viewers. What are the do's and don'ts that are supposed to be followed before and after vaccination? And also, many viewers are asking, is it safe for those with heart condition to take the vaccine?
So I'd like to answer the second question first. That it is safe for the patients who have heart conditions as well. We all have to immune ourselves with the vaccine. And coming around the first questions is that whenever we go to the centers as well, we have to wear a mask properly. We have to have the social distancing. Very, very important. I have seen that the people who are coming for vaccinations are just forgetting that. And even the people should understand vaccination is not 100%. You have to take your precautions well.
Yes. Thank you, Dr. Sanket Jain, for answering that question. And we have Jaydhar Gupta. He's a founder of Nirvana Being and founder of the Citizen Movement, My Right to Breathe, joining us live from New Delhi. Jaydhar Gupta, a lot of viewers asking us about the importance of mask wearing as well. Like how to wear a mask, what is double masking. So if you could enlighten our viewers on what are the steps, which is a safe way to wear a mask, and what double masking is exactly. If you could tell our viewers that.
Well, let me just tell you that from a civilian point of view, the only two things that civilians need to do right now is wear a fitted mask that has efficacy, hopefully an N95 mask if you can get your hands on it, or a mask with certified or tested viral filtration efficiency, okay? And the second thing is social distancing. one of the places where I think people are very, very unclear is people think that the viral load, in terms of social distancing, is high outdoors. Actually, the viral load is less outdoors. It's very high indoors. So indoors, even social, I don't understand the concept of social distancing because there is no safe place indoors. Even if you're 100 feet away and you've got one infected person in the room, in that shared indoor space, you are at risk. There is no safe place indoors if you've got anybody infected with you. So when you're outdoors, yes, 6 to 8 feet, social distancing works. When you're indoors, there is no safe place if you're indoors with an infected person. And this is a huge, huge problem because when one person in a house falls sick, everybody is falling sick because people don't understand. There is no social distancing indoors. There is no safe place indoors. This is highly, highly contagious, highly virulent. It's going to get everybody in the household unless they practice barrier care. What is barrier care? You have to, if you've got anybody infected in your home, you have to put on an N95 mask or you have to double mask. You have to put on gloves. Not only that, all the waste, this biomedical waste has to be packed and sealed and disposed. There are special agencies that will come and pick it up. You can't even throw infected waste with your regular waste. These are really, really important protocols that need to be communicated to everybody. Because even if one person in a house gets COVID, everybody's going to get it unless you practice these protocols.
Yes, Jayadhar Gupta, very strong message, the very important message on masking, there it is. And just a follow-up question on masking to Dr. Zahir Virani, because we heard a few days back, we heard Niti Aayog Niti Aayog officials saying that it is advisable to wear a mask even at home. So if you could tell our viewers, is it necessary to wear a mask at home? If yes, what sort of a mask should be worn at home? And for how long should it be worn, and what are the precautions to be taken at home when a person is home quarantined and at home in terms of masking?
So as my colleague mentioned before, that if you have an infected patient at home, it is very difficult in our setup to basically home quarantine. In Bombay, with the help of the BMC and the task force, we have always suggested that if it is possible and we have the resources, then these patients should be sent to a corona care center where they can be isolated. As my colleague also mentioned, that to get rid of the hazardous material, it is very difficult. If it is not possible, then you can use a surgical mask, which is freely available. And the person who is basically infected has to be isolated into a separate room with preferably a separate bathroom. Now, these sort of facilities are not available to all of us in Bombay or in any of our metropolitan cities. So the best thing for this type of person would be to shift to a corona care center where he can be monitored as well, and it will also prevent infection to his household members.
But Dr. Virani, is it necessary for people who are not COVID infected to wear a mask at home?
That basically is not possible. See, you might have an asymptomatic infection. For how long are you going to continue to wear masks? The treatment for this disease, the treatment for this pandemic is vaccination, and we should move forward at light speed if possible to get our population vaccinated. It is not possible to keep wearing a mask at home. There will be a periods of time at least when you will remove it for your food, for your drink, to go to the washroom. It is not humanly possible to be wearing a mask continuously at home 24/7.
Yes. Yes, that's a very important clarification coming from the medical fraternity, because there was a lot of talk about whether to wear a mask at home or not. My next question would be to Dr. Sanket Jain. Dr. Jain, if you could also tell our viewers about the medicines that can be taken in case there is a side effect of vaccines. Because we know a lot of people get fever after vaccine. There is a pain that they experience in the arm. So if you could enlighten our viewers about the possible side effects and the precautions that can be taken for that, and medicines which could be prescribed for that.
So basically, patients experience mainly fever as the main symptom, or some amount of generalized weakness, or there is pain at the site of the injection. So a simple paracetamol should work in this kind of patients.
In case of, is it advisable to take a painkiller before or after vaccination, Dr. Jain?
I don't think so. We should take a painkiller. Paracetamol is the safest way to be taken.
And Doctor, there are also a lot of questions about whether a person, about the dietary habits on what a person could eat, and what is the interval that is supposed to be kept before and after vaccination. If you could tell our viewers about that.
After around 1 hour, a patient can start having a light food with some amount of a tea or a juice. They can start having it with some amount of biscuits and all. And before that, an hour before that, a patient can come for a vaccination.
Okay. Thank you very much, Dr. Sanket Jain, for telling our viewers about the questions that they have on the vaccination process. My final question would be to Jaydhar Gupta. If Mr. Gupta, if you could also tell our viewers about, because we see a lot of people who do not take masks very seriously, who do not take the entire process, the protocol of masks very seriously. So while some population is very aware and very vigilant in particular about it, so how is it that we can ensure that there is an effective implementation of wearing masks across the board?
You know, the kind of humanitarian crisis and medical crisis and economic crisis that we have at hand, I think the only way in our country to make people walk the line is by penalizing bad behavior. There have to be strict fines that have to be enforced by RWAs, by fellow citizens, by whatever mechanism possible. Because one irresponsible person can, take everybody in their house down, and not only in their house, but in their community down. So it is imperative that we, really step down and penalize bad behavior. I don't think there's any way to stop this. We've got a extremely virulent, we've got double mutant variants, triple mutated variants. We don't even understand these variants completely.
Yes.
But we are seeing that they are highly contagious. We are seeing that they are lethal. We are looking at mortality. The only way to stop irresponsible behavior is by fines, by imposing heavy fines. Because
Yes.
the cost to the healthcare system, to the medical community, to the state, to the country, is extremely high of these irresponsible behavior that from these individuals who fail to practice any kind of caution.
Yes. Yes, absolutely. Strict protocols, in fact, fines are necessary to ensure that masks are worn at all times. That's all that's all the questions that we have for today from our viewers. Thank you very much, Dr. Sanket Jain, Jaydhar Gupta, and Dr. Zahir Virani for joining us live in this broadcast.
Thank you.
Thank you.
Thank you.